Good afternoon. My name is Tyler Goff, and I'm one of the transitional year residents in the class of 2018. This video is also co-produced by Matt Floyd, one of the transition year residents in the class of 2018. And today we will be giving a tutorial on how to write discharge orders. So let's go ahead and get started. So first you're going to want to go ahead and log into Epic. Once you've logged in, you're going to be brought to this main screen, and you're going to click on the Discharge tab on the left side of the screen. Then you're going to click on Discharge Orders tab. This will bring you to the Review Orders tab. These will be the orders that the patient has had placed during their hospital stay. So you're going to want to review all of these and decide which ones you want to continue, discontinue. This Review Orders tab will also have their home medications. You'll want to review which medications you want them to continue on, and you can modify them accordingly. Here we're prescribing a year's worth of aspirin with 2 refills. One thing to keep note of when you are doing these medications is that if you click normal, it will normally go to their outpatient pharmacy. If you click print, it will actually print out the medication for you to sign the prescription at the nursing desk. The next tab is the New Orders tab. You're going to decide where you want the patient to go, whether it is home, a short-term hospital, a skilled nursing facility. Click Today, click Accept. The next order that we're going to click is a discharge order set. So you do the dot phrase .discharge, click on Discharge, and this will bring up a discharge order set. The first thing that you have to do is type in who the attending physician is on the case. So our attending physician is Dr. Brandon Davis. So we'll type that in, click Accept, then move on to the person responsible for the discharge summary. And that will be yourself. So you go ahead and enter in your name. In this case, it'll be Matt Floyd, and click Accept. This will send you a request to complete discharge summary in 2 days' time if you have not filled it out. So then you're going to go through this discharge order set. Obviously we don't want them to go home with an IV, so we'll just continue that. Look at the activity instructions that you want them to go home with. So normal activity as tolerated for this patient, return to their previous diet, and then you'll want to click on several different things for how you want them to call their PCP or provider based on the symptoms that they're having or start to have, so they can be treated appropriately. So next you're going to continue to scroll. If they need dressing, click what kind of dressing you want or why. The referrals and follow-ups tab is a very important tab in this discharge order set. You can arrange for OT, PT, and speech therapy, cardiac rehab, etc. And then you can click which providers you want the patient to follow up with once they're discharged from the hospital. So I generally would always click the follow up with primary care provider tab, and normally advise them to follow up with their PCP within 1 to 2 weeks time. Depending on why they were admitted to the hospital, you'll want them to follow up with a subspecialist. So in this case, the patient was admitted for a stroke, so we're going to have them follow up with a neurologist. You type the neurologist's name, and that will kind of key that into the system, and will add their physician's address and phone number so that they can call and set up an appointment. I would normally also put an ambulatory order to have them follow up with neurology. It would be an ambulatory consult to neurology in the new orders box down there that says additional discharge orders. That way the patient has 2 ways of getting in contact with the subspecialist. One that will be forwarded to the subspecialist's office, and on the patient side for them to call and set up an appointment. That way you have both methods specified and in place. Sometimes you'll get a red flag, such as the antithrombotic therapy at discharge flag. Just review the boxes in there and select a reason, or you can free text a reason. Then click Next. This will bring you to the Review and Sign tab. This is where you can just go ahead and get a quick glance of all of the orders that you've modified, discontinued, told to resume on discharge, etc. All the things that you've just done previously. It's a good idea just to kind of review everything and make sure you're doing the right things before you click the sign button, which will make the discharge orders final. So once you click sign, the discharge orders are in place. This will go to the nursing staff, and they will go ahead and get the patient ready for discharge. Once you click sign, your prescriptions will be sent either to the outpatient pharmacy if you clicked normal. If you clicked print, the prescriptions will be printed out at the nursing desk, and you'll have to go over there and physically sign the prescriptions. I normally would do this so I could go ahead and have a discharge talk with a patient before sending them home. So now your discharge orders are in place and finalized. The next step would be to write a discharge summary. Click New Note. This will bring you to the Edit Note tab. Make sure when you put in the type you type in discharge summary. This will auto-populate a discharge summary template. You'll put in your cosigner, which is your attending, and then you can go ahead and start filling out the discharge summary template. It's pretty self-explanatory. You just kind of go down the list. The first 3 stars that you need to fill out is under the primary discharge diagnosis. So for this patient, it was a stroke. Then under the secondary discharge diagnoses, you'll put things like their chronic medical issues like hypercholesterolemia, diabetes mellitus type 2, etc. But the primary discharge diagnosis is the one that you'll put for why the patient was actually admitted to the hospital. The secondary diagnoses are more chronic problems to let the person reading the discharge summary so they can be aware of those. So if you scroll down further, a lot of these things have been auto-populated, but under the discharge disposition, you'll want to put where the patient is going, whether it's home or self-care, or whether they're going to a skilled nursing facility, etc. Their discharge medication should auto-populate as it has in this template, as well as their diet. Active issues requiring follow-up, you'll want to put what issues the patient actually needs to follow up on what specialists they need to go follow up with. So for this patient, since they had a stroke, we'll want them to follow up with neurology for further evaluation of their possible vasculitic process. This is just an example of what you can place in that section there. For outpatient follow-ups, that should auto-populate for normal patients, but because this is a simulated environment, it did not auto-populate. This will bring you to the details of hospital stay. This is kind of the meat of the discharge summary. For the presenting problem / HPI, I normally copy and paste the HPI portion of the HMP so they can see exactly how the patient presented. Or the consultant's ordered, you'll put the consultants. Apparently Matt Floyd thought I would be consulted for an annual prostate exam. I can assure you that would never happen. But then underneath the hospital course, you'll actually type in what happened during their admission or hospital stay. It's good to keep this brief in general, more of a summary rather than a detailed account of every day. The reader should be able to read your discharge summary and get a good feel for what happened during their stay and get the primary bullet points without having to spend too much time reading. Make sure underneath the physical exam tab that you go ahead and enter in the physical exam. You can right-click on that physical exam tab and it'll bring you to another template. Once you've done all those things, you'll click sign, and that will be the end of your discharge summary. Pretty simple, self-explanatory. Again, a lot of it is auto-populated, but the recount of their hospital stay can take some time. Most of the time you'll have to go back and look at previous notes or progress notes from previous days so you can kind of get in your head an accurate chronological recounts of what happened to them during their stay so that their reader can know exactly what happened during their hospital stay. Again, this concludes our tutorial of how to write discharge orders and how to write a discharge summary. We hope you've enjoyed our video series, and we wish you best of luck in your intern year. Thank you.